Before you take your next pill tonight, stop. Because what I am about to share with you in the next few minutes may be the most important health information you have never received from your doctor. And it is sitting inside your medicine cabinet right now. I am not speaking in hypotheticals. I am speaking about a category of drug-induced cognitive destruction that affects millions of adults over 60 right now. And the most devastating part is not that it is happening. The most devastating part is that it is being mistaken for Alzheimer's disease every single day in doctors' offices across this country. And before this video ends, I am going to give you a specific 5-word phrase you can say to your doctor at your very next appointment that will immediately trigger a full medication review for dementia risk. Write it down when it comes. It may be the most important words you speak this year. My name is Dr. Clifford Adeshina. For over 2 decades, I have dedicated my life to one mission: giving adults over 60 the health information they deserve to have but rarely receive. Not because doctors are hiding it, not because the system is corrupt, but because a 15-minute appointment was never designed to cover everything that matters. This channel exists to fill that gap, with honest information, with real research, with the kind of clarity that puts you in control of your own health. This is not a channel for generic advice. This is a channel for the truth that changes how you live, and it starts right now. In over 20 years of medicine, I have watched patients receive dementia diagnoses that were not dementia at all. They were prescriptions. By the time this video ends, you will know exactly which 9 medications carry the highest dementia risk after 60, why the danger multiplies when several are taken together, and the one hidden pattern affecting millions of seniors that almost no doctor addresses in a routine appointment. I want to tell you about a man I will call Roland. Roland was 71 years old, retired engineer. The kind of man who built his own bookshelves, maintained his own car, and never missed a grandchild's school play. His wife Eleanor told me he was the most organized person she had ever met in her life. Color-coded filing system. Every bill paid on the same day each month. He could quote from memory the exact specifications of a bridge he had helped design 30 years earlier. Eleanor told me that for the first 6 months, the only sign was that he stopped humming. Roland had always hummed while he worked. Old jazz standards he could not name but had learned from his father. One morning she realized she had not heard it in weeks. She did not know why she noticed. She did not know what it meant. About 2 years before his family brought him to my attention, Roland had been prescribed 3 things in the space of 14 months. A bladder medication after a routine urology visit, an over-the-counter sleep aid he had started taking on his own after some stress-related insomnia, and an old antidepressant prescribed for nerve pain in his lower back by his orthopedist. Each prescription had come from a different provider. No single doctor had seen the full picture. Eleanor first noticed the larger changes on a Tuesday morning. Roland could not remember where he kept the coffee mugs. The mugs had been in the same cabinet for 19 years. She told herself it was just a moment. We all have those moments, but then the moments became patterns. He stopped filing. He got confused about which grandchild belonged to which of their children. He repeated the same story about the bridge 3 times during a single dinner. When she took him to a neurologist, the neurologist used the words early-stage dementia and referred them for further cognitive testing. Eleanor told me she drove home from that appointment and sat in the driveway for 20 minutes before she could walk inside. What nobody had done, not the urologist, not the orthopedist, not the neurologist, was look at all 3 medications together and calculate what they were doing to Roland's brain in combination. When we did that, when we worked with his physicians to methodically reduce his medication burden over several months, under careful supervision, Roland came back. Not completely, not instantly, but the filing system returned. He started attending the grandchildren's plays again. Eleanor told me the moment she knew he was returning was the morning he corrected a news anchor on a structural engineering detail, and then laughed at himself for doing it. Roland's story is not rare, it is heartbreakingly common, and I am about to show you exactly which medications built the wall between Roland and his own mind. Your brain communicates through a chemical messenger called acetylcholine. Think of it as the postal service of your mind, responsible for every memory you form, every word you retrieve, every moment of sharp, focused thinking. After 60, that postal service naturally runs with fewer resources. Then you add 1 medication that blocks it. Then 2, then 3. You are not just short-staffed anymore. Someone has locked the warehouse. And in the brain, when acetylcholine cannot do its work, memory fragments, concentration dissolves. Brain tissue, actual measurable physical tissue in the memory centers, begins to shrink. Multiple peer-reviewed MRI studies have confirmed this in human patients, and the symptoms that result are clinically indistinguishable from early Alzheimer's disease. Now let me show you exactly which medications are locking that warehouse and what you can do about each one. Number 9. Diphenhydramine. The most dangerous medication in your home may be the one you bought without a prescription. Diphenhydramine, the active ingredient in Benadryl in every PMOR's formula, is one of the most potently anticholinergic compounds a person over 60 can take regularly. A study in the Journal of the American Geriatric Society found measurable volume reduction in memory-related brain structures in regular users. The blockage accumulates night after night, without a single warning label to tell you what is happening inside your brain. Tonight, check every bottle labeled PM nighttime or sleep aid. Ask your doctor about loratadine or cetirizine for allergies. These do not cross the blood-brain barrier the same way. For sleep, safer alternatives exist and we will cover them before this video ends. This was one of Roland's 3 ingredients, not prescribed, chosen himself because the package said sleep aid. Number 8, proton pump inhibitors. This one does not attack the brain directly. It attacks what the brain needs to survive. Proton pump inhibitors, omeprazole, esomeprazole, lansoprazole, reduce stomach acid. The problem is that stomach acid is also how your body extracts vitamin B12 from food. B12 maintains the myelin sheath, the insulating coating around every nerve fiber in your body. Deplete it and nerve signals slow, fragment, and fail. A 2016 study in JAMA Neurology, examining more than 73,000 adults aged 75 and older, found that long-term PPI users carried a 44% higher risk of developing dementia compared to non-users. If you have been on a PPI for longer than 12 weeks without reassessment, ask your doctor to test your B12 and magnesium levels. Ask whether an H2 blocker like famotidine might be a safer bridge. Number 7, bladder control medications. This is the medication that surprises people most, and the one I believe causes the most invisible damage. Oxybutynin is prescribed for overactive bladder and it is genuinely effective. It is also one of the most potently anticholinergic medications still in widespread use. A comprehensive study published in the British Medical Journal in 2019 found that seniors using oxybutynin for more than 1 year carried a 49% higher risk of receiving a dementia diagnosis. The early signs, forgetting appointments, losing words mid-sentence, get dismissed as normal aging. The medication never gets questioned. A newer medication called mirabegron works through a completely different mechanism with dramatically less cognitive risk. Ask your doctor that one direct question: is there a lower risk alternative for my bladder condition? If you are recognizing someone you love in what I am describing, a spouse, a parent, a friend who has been getting foggy, and everyone assumed it was just age, type the word Roland in the comments right now. I read every one, you are not alone in this. Number 6, benzodiazepines. Benzodiazepines have provided genuine relief to millions of people at some of the hardest moments of their lives. I respect that. What I am asking is that you hear the long-term research. Diazepam, lorazepam, clonazepam, alprazolam. These work by amplifying GABA, your brain's natural calming signal. The long-term consequence is that your brain downregulates its own activity in response. Neuroplasticity deteriorates. Memory encoding slows. A study tracking more than 8,000 seniors over 6 years found that benzodiazepine use exceeding 3 months was associated with a 51% increased risk of Alzheimer's disease. Never stop a benzodiazepine abruptly, that is medically dangerous. But speak with your physician about a supervised taper. Alternatives including buspirone for anxiety and CBT for insomnia carry strong evidence and none of the cognitive risk. Number 5, statins. Statins save lives. Cardiovascular protection through statins is real. But here is what your cardiologist may not have had time to tell you. Your brain is approximately 60% fat. Cholesterol in the brain is a structural material. It builds the myelin sheath and supports the synapses where neurons communicate. The FDA updated statin labeling in 2012 to include memory loss and confusion as potential side effects. A 2023 analysis in Frontiers in Aging Neuroscience found that seniors over 70 using high-dose statins for more than 3 consecutive years showed measurable increases in mild cognitive impairment. Not all statins carry equal risk. Lipophilic statins like simvastatin and atorvastatin cross the blood-brain barrier more readily than hydrophilic statins like pravastatin and rosuvastatin. If you are experiencing brain fog, ask your doctor about switching, and ask whether your QOQ10 levels have been tested. Number 4, amitriptyline. This is the one I want every person over 60 to remember by name. Amitriptyline is an old antidepressant now commonly prescribed for nerve pain, migraines, fibromyalgia, and insomnia. Its anticholinergic potency is among the highest of any medication still in widespread use. A landmark study in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older for a decade and found that high cumulative anticholinergic exposure, with amitriptyline among the top contributors, was associated with a 54% greater risk of dementia. Low steady doses over years created significant damage. There is no dramatic warning moment, only a slow erosion that looks like aging. For nerve pain, ask about duloxetine or gabapentin. For sleep, low-dose doxepin carries a far more favorable cognitive profile. For depression, modern SSRIs, with one exception I will cover next, are significantly safer. Number 3, antipsychotics. What I am about to tell you happens every day in care facilities across this country, and most families never find out until the damage is done. Antipsychotic medications were developed for serious psychiatric conditions. They were never intended for elderly patients who are simply confused or restless. And yet they are being prescribed in exactly those circumstances, not for the patient's benefit, but for the convenience of under-resourced caregiving environments. A 2022 study in the Lancet Healthy Longevity, tracking more than 25,000 older adults, found that seniors given antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 12 months, even with no prior dementia diagnosis. The FDA issued a black box warning about this practice. The prescriptions continue regardless. If a loved one in a care facility is receiving quetiapine or risperidone for behavioral reasons, you have the right to ask why, to ask what the exit plan is, and to ask what non-pharmaceutical approaches have been tried. You are not being difficult, you are being responsible. There is a difference, and your loved one's brain depends on you knowing it. Number 2, paroxetine. This one hides inside a category most people believe is safe. Paroxetine, sold as Paxil, is classified as Ensry alongside Prozac, Lexapro, and Zoloft. Most SSRIs are significantly safer for the aging brain. Paroxetine is the exception. Unlike its siblings, it carries significant anticholinergic activity that more closely resembles the old tricyclic antidepressants. A 2021 review in Frontiers in Psychiatry found that elderly patients on paroxetine showed measurable declines in short-term memory and verbal recall within the first year, declines not observed in patients on other SSRIs at comparable doses. The American Geriatric Society has placed it on their Beers criteria, the official list of medications potentially inappropriate for adults over 65. If you are over 60 and taking Paxil, ask your physician whether transitioning to sertraline or escitalopram might offer the same benefit without the cognitive risk. Number 1, anticholinergic polypharmacy. Everything I have shared so far has been leading here, because this is not about any single medication. This is about what happens when nobody is watching the whole picture. Most seniors are not seeing one doctor. They are seeing a cardiologist, a urologist, an orthopedist, a primary care physician, each seeing one part of the picture. A bladder medication gets prescribed here. A sleep aid is started there. An antidepressant is added for nerve pain. An over-the-counter antihistamine is picked up at the pharmacy. Each decision in isolation may be clinically reasonable, but no one has looked at all of them together. When several medications with anticholinergic properties are taken simultaneously, research suggests they do not simply add their effects, they compound them. A 2022 analysis published in Age and Aging tracked more than 280,000 older adults and found that those with the highest combined anticholinergic burden had a 120% increased risk of developing dementia over a 10-year period, double the risk. From pills most of them had never once been warned about in terms of brain health. Think about Roland, a bladder medication, a sleep aid he chose himself, an antidepressant prescribed for his back, 3 prescriptions, 3 separate providers. 0 conversations about what they were doing together to the brain of a 71-year-old man who used to design bridges. Drug-induced cognitive decline is frequently reversible. When the combined medication burden is identified and systematically reduced under proper medical supervision, many patients experience a profound recovery of mental clarity. The fog lifts, the person comes back, not always completely, not always instantly, but they come back. And that is the truth everyone over 60 deserves to hear before accepting a dementia diagnosis without asking one more question. After 20 years of watching what happens to patients who were never given this information, I developed something I want to give you right now. I call it the Brain Burden Audit. 3 steps begin this week. Step 1, write the full list. Every prescription, every over-the-counter product, every supplement, every PM label. Write it on paper and bring it to your next appointment. That list alone may be the most useful medical document you have ever handed a doctor. Roland's family never made that list, not until it was almost too late. Step 2, request the review. Use these 5 words exactly. Review my full medication list. Say it directly. A physician who respects you will sit down with you. And sometimes the most important medical conversation of the last decade costs nothing and takes 20 minutes. Step 3, ask about deprescribing. That word specifically, deprescribing. It signals that you are informed, that you understand medications can be reduced, not just added, and that you expect a real answer. A growing field of geriatric medicine is dedicated entirely to this process. You are entitled to access it. The Brain Burden Audit. Write it down. Use it. 9 medications, millions of seniors. 1 conversation. That almost never happens in a 15-minute appointment. You now have everything you need to start it. What you receive today is not a list. It is a key. A key to a conversation that most seniors never get to have. Not because their doctors do not care, but because the system was never designed to give them enough time to have it. You have that key now. The kind of person who watches a video like this to the end is the kind of person who shows up for their own health and for the people who depend on them. That matters more than you know. If someone you love is taking any of the medications we discussed today, a spouse, a parent, a sibling, a neighbor who mentions they have been feeling foggy and everyone assumed it was just age, Send this video to them right now, not tomorrow now. You may be the reason they ask the question that changes everything. Subscribe to this channel and turn on your notifications. What I share today is the standard on this channel, not the exception. And before you go, have you or someone you love ever experienced memory changes or cognitive fog and later discovered a medication may have been involved? Type your answer in the comments. I read everyone. And your experience may be the thing that helps someone else recognize what is happening to them. Eleanor did not need a miracle. She needed someone to look at the whole list. You now know to ask for that. And that knowledge, that one question, asked at the right moment, may be worth more than anything else in your medicine cabinet. I am Dr. Clifford Adeshina, and I will see you in the next one.